All right. So welcome everybody. Today, we're going to talk about the COVID-19 antibody testing. We've had many questions about this. So today we have Dr. Khater here, who is the Chief of Infectious Diseases, ARH and MCHC here to answer our questions. So Dr. Khater, welcome and thank you for doing this for us.
Thank you.
All right, so I'll start with the first question. So what exactly is COVID-19 antibody testing?
Well, thank you for having me here. It's always good to come back. As all of you know, COVID-19 infection has several ways to diagnose it. Up till today, the standard of care has been the nose swab or the nasopharyngeal swab. You know, it's a swab that we do and it will detect the virus in the nasopharyngeal area or sometimes in the throat or sputum. And that is the standard of care to diagnose somebody who's having an active infection. However, the antibody testing is a blood test that we do, and it's an indirect way to diagnose COVID-19. And let me say this actually better, is to measure the antibody response of the immune system to the virus. So it's what we call the indirect way to find about the virus. So, you know, it's a very important tool in patients who have minimal or mild symptoms.
Okay, thank you. So exactly how, like, you kind of described how it works, but how does the testing itself work and detect?
Yeah, that's a great question. So after initial infection with COVID-19, after 7 to 10 days, roughly, the body starts to produce antibodies, which is the immune system way to fight the virus. Usually antibodies start around 2 weeks and they go up. And we have two types of antibodies. One is called IgM and one is called IgG. The IgM starts first. It starts around 2 weeks and go up, and start going down at week 5 to 7, while the IgG stays in the body for weeks and months after the infection. So the test is a blood work. We try to measure by what we call ELISA, a method to measure these antibodies in the blood to tell us if the infection has happened with that specific virus.
Okay, so how accurate, how sensitive is the COVID-19 antibody test?
Okay, good question. So everybody who wants to have a test done, especially a blood work done for antibody testing, wants to have a test that's 100% specific. That means no false positive results, and 100% sensitive. That means no false negative results. As of today, we don't have that 100% yet. As of today, all these tests are new. There are a lot of them on the market, and they are not FDA approved, and their specificity and sensitivity varies between one test and the other. And we hope that the test that we're using is going to be at least 95% specific or maybe more, and 95% sensitive or maybe more. And as we start testing more and more and more patients, hopefully the tests will become more specific and more sensitive.
Okay. So in your expert opinion, who do you think needs to have the antibody testing? And conversely, who doesn't need to have it?
Yes, yes. So there is two categories of patients: who should have the test and who should not have the test. So I'm going to start first by who should have the test. So if somebody think that they have been exposed to the virus, at least in the 2 weeks or more, they've been sick, they thought that they've had COVID-19, they're not sick anymore, and they want to be sure if the body has produced immunity to that virus. And that would be a good way to do it. You can do an antibody test And if the antibody test is positive, it tells you that the immune system has mounted a response. Of course, it can be a false positive because that test also has tendency to pick up other coronaviruses that we have now circulating in the community. They cause what we call the common cold, and there's 4 of them. So, it is not 100% saying that your immunity is due to COVID-19, but it can help. So it's somebody has been exposed to the virus 2 weeks or more before that, or somebody who wants to know if that mild or moderate infection they've had 2 weeks ago or more has been the COVID-19. Now, who should not get that test? So anybody with fever, anybody who's sick should not get that test. They should get what we call the standard of care, which is the nasopharyngeal test that we do, the swab. Or somebody who's been sick but has not been more than 10 days yet. They should not get the antibody testing. They should get the nose swab. And there's one category of patient that should not get the antibody test, is people who have very low immunity, either by disease or by treatment, like cancer treatment or immunosuppressive therapy, because these patients are not able to produce antibodies.
All right. You answered that question really well. I appreciate that.
Thank you. Thank you.
So, okay, let's just say somebody has a positive test. Does that mean that they're universally immune? Yeah, that's a phrase that we hear right now, universally immune. So can you talk a little bit about that, and what does universally immune mean?
Yeah, universally immune is when people want to know if they have a positive antibody test, and let's say that positive antibody test is for COVID-19, and they want to know if they're universally immune, means they can go out and about, see patients with active infection, don't worry about getting the infection again, and they're just what we call a protective immunity. Unfortunately, as of today, we don't know yet if that immunity is protective, and we don't know how long that immunity lasts. We know it lasts a few weeks to a few months, which is good, but we don't know beyond that. And we don't know if that immunity is protective or not yet. We want it to be protective, but we don't know that yet. So our knowledge about how long and how protective that immunity is, it's still in the baby stage.
Okay, all right. So I think the last question that I have is about the availability of this test.
Yeah, so this test should be available next week. We're talking on a Friday now, and it should be available next week, starting May 11. It can be done by visiting your doctor, or even by telehealth. The doctor can see the patient by telehealth and order that test, and the patient can go to the lab and have his blood work done or her blood work done. And after a simple stick, the test goes to the lab, and the test should be back in 3 to 5 days.
Well, see, you just answered the question I was getting ready to ask.
Yeah, it should be available. It should be available as outpatient and inpatient as well.
Okay, good. Is there anything else that we haven't covered that you think that that people need to know?
Yeah. So I would like people to know that there is on the market right now around 100 tests that are trying to test antibody. The FDA has allowed labs around the country to release their testing that, again, they're not FDA cleared or approved yet, but they want the public to have access to this availability. And some of these tests don't perform too well. And I just want people to be careful not to be just trusting every test. The ARH is rolling testing next week, and I'm sure the clinic here at MCHC will be rolling it as well. These are respectable labs, and they will have the accuracy of the test to the best they can as of today. And these tests are not the only tool for COVID-19. It's a tool in the toolbox. Right. You use the test along with monitoring symptoms, along with a nasopharyngeal swab. It helps as a tool in the toolbox. It is not the only way to diagnose COVID-19, and it should not be, trusted as the only test to diagnose COVID-19.
All right. thank you so much for your time. I really appreciate it. I know that you've got lots of work to get back to. So thank you for doing this for us.
Thank you for having me. Bye.
Okay, bye-bye.